I hope you're all well. Thanks so much for joining today. I'm excited for this talk with Dr. Leah Murray. I think so many of us, as women especially, struggle with thyroid issues that sort of hit us during perimenopause, menopause, or sometimes even before. People experience, adrenal fatigue, a sense of, where your body attacks itself. So that's what we call autoimmunity. So I'm just going to invite her in. She is the most incredible woman. I had the privilege of attending a retreat with her. Okay, let's can get going. I know there's load shedding, and she is working off her 3G, unfortunately. Hi.
Hi.
Leah. Hi, how are you?
Good, and you?
Good. And there's always these technical hiccups with this, it wouldn't be unusual.
Yeah, no, tell me about it, especially with the load shedding. That threw me completely, but we're all good now.
Good. Nice to see you. Thank you. I was just introducing you. And I just was saying that I had the privilege of actually attending the retreat, and how incredible it was for all of us that attended, and just the insight and the experience and the knowledge and sincerity that you have is truly remarkable. And when I posted the post that we were doing this, many people actually thought that we were doing a talk live, and they were, where is it? I want to come. So maybe something to consider.
Okay.
Because this seems to be such a huge topic. So let's start off. Give us a little bit of background, even just your journey, because you shared it during the retreat. And I think it's such a powerful thing, because when people have not only the knowledge, but the first-hand experience in terms of healing, that's where real transformation happens. So it's not textbook. It's actually, this is what I went through. And working with people, you even have more sort of an expansive mind around it. So let's start there.
Great. Yeah, I mean, it's a very interesting one, because I was interested in a more holistic approach in med school already, and I spent some time in my 4th year with Dr. Bernard Brom. So he's the founder of integrative medicine in South Africa, and I spent a month actually shadowing him, because already then I kind of felt that med school training is very disease focused and not as holistic as I was actually brought up as a child. And then, I don't know, kind of on the side was studying integrative medicine, but then just life happened, and I ended up spending quite a few years after qualifying I spent 6 years doing emergency medicine, which I loved. It was very kind of exciting and diverse and never boring. But I actually ended up burning myself out completely, and really kind of able to then apply all of the adrenal stress knowledge on myself. I ended up with Hashimoto's thyroiditis. And yeah, it was just the kickstart I needed to really kind of open up my own integrative GP practice. And that's been about 8-9 years now. And it's just such a satisfying way of working, and I love it. So yeah.
And Leah, why is it that because I come across so many people with Hashimoto's, it seems more prevalent now, and I think many people in the conventional blood testing, they often don't do the full look at exactly what's going on, especially with female hormones. And so what is it that people need to look out for? Because in my sphere of just people that I'm around, most women have Hashimoto's, and it seems so common. And it's the body's sort of operating system is not default. It's being diseased or at some kind of having something doesn't mean that it's actually almost a gift in a way, as horrible as that sounds. But our default system is not to be ill or unwell or low energy or in chronic pain or low mood or hormones all over the show. So why is it that this is, in your view, so common.
Yeah, I mean, it was something in med school, it was something that was really rare, and now I almost diagnose it weekly.
Yeah.
And the reason, I mean, there are a few reasons for it. One of them, and as you put in the topic of this talk, is definitely the gut link. So actually, most autoimmune conditions will come about as a result of leaky gut. So the medical term for that is increased gut wall permeability. So our gut lining, and when I talk about gut, I'm talking about everything from your mouth all the way down to your bum. And the lining of that is actually, so your gut lining is a permeable membrane. It needs to be in order for you to absorb nutrients from your food, but it can become too permeable. And this is something that's really common. I don't think any of us don't have some element of leaky gut these days, because our food is our sort of inconvenient food is generally going to be very inflammatory. We are generally really stressed out. I think pre-COVID we were stressed. Post-COVID we are just
it's exploded.
And that's your sympathetic nervous system, so your fight and flight response that's just activated the whole time. And then even kind of one course of antibiotics or things in our environment that we're exposed to that disrupts the fragile balance in the microbiome, which is the colony of bacteria and yeast that live in the gut. All of these are factors that lead to that gut lining becoming too permeable or leaky. And then you're getting particles that should be staying inside the lumen of the gut, so inside the tube, and not getting into the bloodstream, because it's actually just one cell layer thick, your gut lining. So there's literally one cell that separates the inside of the gut, the lumen of the gut, with the blood, your bloodstream. So you really want the little junctions, which are called tight junctions, which are the little junctions between the cells that make up the gut lining. You want them to be tight and not leaky. But in reality, most of us do have these at least leaky patches. So we're getting stuff that's inside the lumen of the gut coming into the bloodstream. That would be fine if it happened every now and again, because the immune system sees it, launches an immune response, and gets it out of the system. But if it's happening the whole time, you get this immune system overwhelm, which is what autoimmunity is. So where your immune system gets overwhelmed and starts attacking your body's own tissues. And your thyroid is a very susceptible gland to that.
Yeah, it's so interesting. Just the power of, leaky guts is not even a term a lot of doctors recognize. They see it as like, what was it? Irritable bowel syndrome or inflammatory gut, but it's actually a real term.
Yes.
And as a functional medicine practitioner, you understand that, it's very real. It's like adrenal fatigue may not be recognized, but this link. So what I really appreciate and honor about how you work, and many people who have worked with you, is that you will go back in, take full history, what happened before you got sick, because there's an emotional connection to all of these things.
Absolutely.
And so much so we know what we should be eating or not eating. And I think what happens is, because of the emotional thing, is actually what causes us to self-destruct or have behaviors that are not optimizing our health. So working with someone is incredibly powerful as a guide, as someone who's able to equip you with tools. And I spoke to some of the people that were at your retreat that had worked with you, and you put them on a protocol that is very powerful. And I don't know if you want to touch on some of that, because sometimes you get a diagnosis and you think, okay, well, now I'm going to go onto thyroid meds, and this is just now my biology, right? And the power of just changing our nutrition, how it affects us on a cellular level, our environment, our relationships with ourselves, with our environment, how we deal with stress. And we often overlook these very powerful elements of what makes us whole and what contributes to our vibrancy or ill health. So maybe touch a little bit on your, you know, it's very individual, obviously, but on how you approach this, because it doesn't mean it's all doom and gloom. There's so much that can be done, right?
Yes, yeah, absolutely. I mean, you know, if you work from a conventional GP point of view, if you feeling tired, your hair's falling out, you're putting on weight, you're brain foggy, your skin's super dry, you've got no libido, and you go to a GP, and hopefully they would at least screen your thyroid, and generally it would be a TSH, which is your thyroid stimulating hormone, sometimes a T4. So that's a very basic thyroid screen. The thyroid, so the labs, Path, Lancet, Ampath, all of them have a very sort of wide range of normal when it comes to your thyroid function tests, because it's everything from a baby to a geriatric, and we're kind of all just thrown together. So, for example, a woman in her 30s would have a much tighter range of optimal thyroid function. So if you're not fitting into that range of normal, then potentially you'd get started on just T4. So that's your euthyrox or Eltroxin. And that's kind of where the buck stops. You get started on that, and in 8 weeks' time, you'll have another level to check that your dose is fine, and that's it, lifelong treatment. And we don't really get taught to delve deeper than that. From a functional medicine point of view, we'd look at the TSH and the T4, but ideally we'd want to know your T3, we'd want to know your thyroid antibodies, we'd want to know a few other things that help your thyroid work better. So, for example, you've got 5 things that open the little T3 receptor on all your cells. So it's hard for me to not go so deep into all the science. So just rein me in if I'm going to.
Go ahead. This is fascinating. I think it's good to understand so you know what to ask for.
Yeah, exactly. So you've got almost every single cell in your body has a little thyroid hormone receptor where T3 goes. So first of all, T4 is the thyroid hormone that gets secreted from the thyroid into the bloodstream. It needs to be converted into T3, which is your active thyroid hormone that goes to all the cells and does what it does. And what it does is actually activate your little mitochondria in all your cells, which are your little energy powerhouses, giving each cell the energy to do what it needs to do. So you need 5 things to be in sufficient amounts to actually open the little receptor and let the T3 into the cell. So those things are, for example, iron, so your ferritin, which, you know, even a level of 30, which a lab would say is sufficient, in some people isn't sufficient. So you really need to optimize your iron. And iron deficiency is so common across the board just because our guts are in such a state. So we're just really not absorbing enough iron from our food. And then in menstruating women, obviously, where you're losing iron every month, that can really be an issue. So iron, you want to check. Vitamin D3, another one. COVID, vitamin D got the limelight it deserves as an immune supporter, but it's actually more a hormone than a vitamin D. And it's crucial, absolutely crucial for hormonal balance to have optimal levels of vitamin D. So that's another thing that opens the little thyroid receptor. Then your ALP is one of your liver enzymes, your alkaline phosphatase, which has a direct correlation to gut health, because we actually use it as a soft marker for either low stomach acid, which we need to talk about because that's another very important thing, very simple to check. We'll come into the gut repair regime that I do with all my patients. So ALP also can be low if there's what we call SIBO or SIFOs, your small intestine bacterial overgrowth or fungal overgrowth. So a lot of us know about Candida as one of the opportunistic growers in our gut. A lot of people struggle with Candida overgrowth. And for women specifically, if you've got a vaginal Candida or vaginal thrush, there's definitely guaranteed to be a systemic overgrowth of Candida. So another thing, and that will bring your ALP down. And then the last 2 things are your adrenal hormones, so DHEA and cortisol. So I essentially would want to know what those are. so that we know that that little thyroid receptor is opening up and letting the thyroid hormone in.
Yeah, for sure. Very important.
Yeah, and then I think just on gut, so all my patients, doesn't matter what they come and see me with, we start off with my phase 1 treatment protocol will always entail a gut reset program, which we did for the retreat. And I'm actually, because it's actually such a, with a sort of very basic screening questionnaire, you can elicit a person's gut type and their current digestive issues that they need to sort out, and quite easily give them a tailored gut repair regime or a gut reset program. And I'm actually busy developing an online version of that, which you can do at home on your own without needing a consultation, because most of the functional medicine doctors are booked up months in advance, and it's something that you can just kickstart, do so long, and then kind of take it up from there.
Yeah, that would be amazing.
I
actually did it. I did your
you? Yeah.
So I filled out, you gave me some feedback, and I did it. And I don't have gluten or dairy and stuff, but I mean, I have really good quality sourdough sometimes.
Okay.
And these sweet potato rusky things from Her Harvest, I think it is. So I removed all that, and it was interesting because even though I don't have a lot of it, it's interesting how you have to eliminate it completely, and not even have a little bit, because I did notice a difference, like just inflammation a little bit, even cravings. Like I craved it more actually because I wasn't having it. So something was like, my bacteria was like, I want this now, and I was like, I actually don't have these kind of cravings, you know. So it's very interesting when you do elimination protocols or something like your repair and restore, that kind of thing, is that actually you have to do it. And I find, I don't know how you know, obviously if someone's very sick, they're more motivated, but I find people like dip and dab. They're like, okay, this is good, but I'm going to make my own rules, and I'll allow this and allow that. And you don't get the full benefits. And I think when it comes to understanding the gut, I mean, your whole immune system's in your gut. I believe that like your feel good hormones are in your gut. So if you're feeling off or down or unmotivated, you know, everything actually starts with this. So your program, actually, even if you don't have a chronic autoimmune disease or don't even feel that you have a gut issue, you don't know how amazing you can feel. Most people are like just on the verge of, okay, I'm managing my life, but you're meant to wake up and feel amazing, you know?
Absolutely. And this is it. One of my favorite ways of describing what integrative and functional medicine is optimizing health in order to overcome disease.
Yes.
But it really is. It's about health optimization. We're not living optimally. And they are there's so many very simple things that we can do that can just kind of, you know, upregulate and optimize how we living. And gut definitely is the best and the easiest way to do that, because as you mentioned, so 90% of your serotonin, it's estimated, is made and stored in the gut, along with many of the other neurotransmitters. So, I mean, and there's so much data out there on the link between, you know, your gut-brain axis and mood, how mood can be enhanced by optimizing gut health. And immunity, absolutely. I mean, I'm seeing so much long COVID, and those patients as well, we have to get the gut right, because if there is that kind of inflammation in the gut, that's really going to affect your ability to recover from viral infections. And long COVID, it's part of my protocol to treat that.
It's so powerful, because I think we get in this loop of medicating ourselves through food and pharmaceuticals, and we don't give the body the chance, you know, in the right environment, the body repairs and heals and rejuvenates and regenerates. And I think over the last 3 years, in my view, because of COVID and just the pure stress. I mean, we always ignore stress, right?
Yes, exactly.
And just the impact of that on our health, on our immunity, on our hormones. And women are specifically very sensitive to the impact of stress.
Yeah.
We tend to be more resilient somehow,
Yeah.
but then when it hits us, you know, it affects every fabric of our being in such a powerful way. And even just, you know, when you did the retreat, you mentioned ashwagandha, you mentioned some really powerful supplements. And I too have seen that these supplements are an adjunct to good nutrition, good lifestyle, and to optimize your health. You cannot continue doing the same thing and then taking these very powerful natural plant medicines and expect, you know, these incredible results. So I always say, you know, work with someone like you, that you can start from the root cause and optimize, you know, optimize your gut, especially because there is an explosion of autoimmune disease and, you know, and so many hormonal imbalances in women, very much linked to nutrition deficiencies. The simple ones you mentioned. I mean, some people have never tested their B12, D3, magnesium levels, or iron, and it makes such a radical difference if you start supplementing. If you are low energy, low mood, can't sleep, and you add magnesium, B12, and iron, it's like within days you're like, well, wow, what happened? You know?
Exactly.
So,
no, and
it's that powerful.
And I mean, on a hormonal front, for sure, I get infuriated when I get patients who've gone through a few rounds of IVF, and I go into their history and I ask what's happening with all of those nutrients, and some of them have no iron or no vitamin D, or they, you know, it's it's crazy.
And they've been on IVF for ages. I know. And I wanted to ask you a few questions that I received before the live. So one of them being is, if you are on thyroid medication, is it possible to get off, or does the body require I think low dose, many people start off with, but then it's a lifelong thing? Or have you seen people that are able to slowly get off?
Yeah, absolutely. So there are lots of options as well. We don't have to rely just on the normal meds, so either use Thyrox or Altroxin. Sometimes people use T3 as well. So there is that route. Otherwise, you can also use a natural desiccated thyroid. That's what I use. Actually don't need it. I'm not on any medication. And especially if you catch it quite early, when the antibodies are sort of starting to rise, you can actually get those antibodies back to naught, and you can normalize thyroid function pretty easily. If this isn't something that's been brewing over the last years, it might take you a bit longer. I think I might have lost you. Are you back? Are you back? Yeah.
Can you hear me?
There, thank you, back. But absolutely, it is something that you can. I mean, it might take a while, and you need to be very dedicated, but it is something that you can reverse. Absolutely,
Amazing. I think that's a big one for people, because also you sometimes go from, you know, doctor to doctor, and then you become more aware and more informative, and then you want to reduce the amount of you know, medication that you may be on, because it becomes a cocktail of things that people start taking for thyroid, autoimmune disease, you know, pain management, all kinds of things. And I have seen so you almost want to work with the body and nurture it and nourish it, and it is about nourishing on all levels, emotional, through food. It's a beautiful way to look at it, is to optimize and nourish. And how radical, I mean, you have seen it, as have I, how radical the transformation is in one's health with the complete basics. It's almost like we actually going back to basics. We
Yes.
sleeping better,
Yeah.
we moving, we in nature, we going back to a way of living that is not just go, 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 you know, more, consume more, do more,
Yes.
because that's leading to this huge, another explosion of burnout, complete burnout, where people are
Absolutely
just not coping with their lives. And I think when people think, oh, is food going to actually make a difference, or are these herbs or these nutrients going to make a difference? And they actually do. I mean, I'm not a medical doctor. But
yeah, no, I mean, I wouldn't have been, when I kind of eventually realized that I'm going to have to make a change from working in trauma, I definitely wouldn't have, well, it wouldn't have been as easy to kind of recalibrate myself were it not for amazing adaptogens like ashwagandha, licorice root, and then all the gut work that I did then. I saw a functional doctor myself, and I had some IV vitamin therapy, but all of that aside, I had to really sit down with myself and decide on how best to undertake a massive lifestyle change, which I think is the most crucial thing. Because the thing is, with adrenal stress, I don't like the term adrenal fatigue because, first of all, it's got a lot of controversy around it, but it's also not what happens. So it sounds like the adrenals get tired and run out of cortisol. It's not really what happens. When the body realizes that your cortisol, which is your main stress coping hormone, has been too high for too long, it actually shuts it down, and doesn't let the adrenals keep secreting such high levels of cortisol, because it knows that cortisol's got lots of side effects, just like cortisone. The molecule's actually identical. But then the body's like, okay, but I'm still stressed. I still need hormone to help me deal with the physical manifestations of stress. And you can get what we call adrenal steal, which is when the body uses either thyroid hormone or progesterone from the ovaries as your stress coping hormone. So as you mentioned, in women, we are very susceptible to the effects of stress because it can directly impact our thyroid function, and a lot of underactive thyroid symptoms can come about purely from stress, adrenal stress, and then progesterone as well. So progesterone is one of your female sex hormones coming from the ovaries, but we call it nature's Valium. So it's our calming hormone, helps us sleep at nighttime, and if that's going to work as your stress coping hormone, you get this relative estrogen imbalance or estrogen dominance, which a lot of us know about. So I love the endocrine system. I'm completely passionate about it. It's such a beautiful body system. They're all beautiful, but in particular, it really is a cool one. And all of those endocrine systems or endocrine organs and hormones, they all in a kind of dance with each other, always trying to compensate and help each other out. Yeah, it's really remarkable. And I think that's...
Sorry, I was just saying, I spoke to my team and I'd love to do a perimenopause workshop or talk with you. It's one of the most, I believe, ignored topics in women's health, and preparing you for menopause, and just how much control we actually do have, right? And even I was speaking to a client yesterday and she had her blood work done, but she didn't do it on day sort of 19 to 21 or whatever it is. So it was totally flawed and she was in such a panic and what's going on. So just like the basics, like really fine tuning based on your biochemistry, working with someone who perhaps is also a woman who understands, you know, these kinds of things. But I would love to do a perimenopause workshop with you, because we kind of, in my experience, people get hit by it. I was very fortunate because my mom's been in this industry, and I actually know Bernard Brom really well. I had just started my master's, and we went for lunch with him. I think he had moved to Stellenbosch already, and I asked him, I said, so what do you believe in? You know, you're like new student, you're so eager to know like what works, and he's like, you know, a guru. He said to me, you know, Vanessa, I actually don't know. He said, I can't tell you what works. He said some patients come and they just need a hug, and that does miracles for them.
Yeah.
And it didn't grab me at the time, because you want the exact diet, the exact supplements. You want to know, the formula, a bit like medicine, like this is the formula. And he had worked, I worked a lot with people with cancer and things like that.
Okay.
And he always said to me, he's like, look at what's happening to them, what's happening emotionally to them. And now we have all this beautiful literature coming out. Gabor Mate's writing about it.
Yeah.
How disease starts. My mom had cancer when I was very young, and she used to do Louise Hay. And that is actually a beautiful way to heal, and we've moved away from these things, and we've lost our power, so we've lost our power to be able to heal the body. And I think going back to that is, and even with something that's not to be healed, it's just, diabetes is the body's way of protecting itself. If you suffer from adrenal issues, your body is actually protecting itself. It's not a disease, right? So your body's so intelligent and so smart. And I too am so passionate about these things, because I feel that we need to shift the conversation. We need to shift the way we approach ill health, because it's actually, in the beautiful scheme of things, it's the body protecting itself in some way. And
absolutely.
as women as well, which is another very big topic, which we will definitely discuss at some point, is that the body wants to feel safe. So it doesn't want to be in this constant stress, fight, flight. I'm not good enough. I could improve. I must do more. We live in this state almost, I'd say, 100% of the time. And what is happening is that all these different mechanisms, your thyroid, your adrenals, your hormones, they're actually starting to not function optimally, because the body doesn't feel safe. So in order for the body to digest food, for you to sleep well, for you to have beautiful hair and beautiful skin and a good mood, the body needs to feel safe, because you're not in that state if you are constantly stressed, right?
Absolutely.
So for me, that's a big thing, because a lot of the queries we've been getting on this topic is, what do I do? What do I take? And we need to approach it and just shed some light on how important it is for a woman to feel safe. And that's my message. I don't know, please do end off, because I know you're on 3G and you have a long list of patients. Everyone's asking me, can you get me to see Leah Murray? And I was like, I cannot, but you can email her.
I know. No, I think it's exactly right. And I mean, I could keep talking forever about it, because I am so passionate about it. But exactly as you're saying, and I love that the body just wants to feel safe, because it does. It actually, your body triages, and especially your endocrine system triages in the way it should. So it's of first importance is your adrenals, then thyroid, then the sex hormones. And you need to take that into account as well, especially if you're working with, fertility or polycystic ovaries or endometriosis, that kind of stuff, and then thyroid as well. You have to look at the adrenals. And I don't know why a lot of my colleagues are just, they don't want to go there,
It's true.
And
I've
the
also
thing,
seen that.
yeah, exactly.
It's a controversial space.
But it's and I mean, this day and age, it's actually top priority, really, that whole balancing your sympathetic, your fight and flight nervous system with your parasympathetic nervous system. And true. It is just, the body wants to feel safe. That's so cool.
And we just got one question about Graves' disease. So once again, it's just, you can answer it, how you view it.
So just same principles. It's still an autoimmune thyroiditis, just with going hyperthyroid. So same principles. Treat the gut, address adrenals, look at all the environmental endocrine disruptors that might be implementing it's slightly trickier to treat than an underactive thyroid, but not impossible at all. Yeah.
Yeah, there you go.
Mm.
Thank you for answering.
Oh,
And it was such a privilege, and I'm so, so grateful that we could do this because
cool.
I just think you're an awesome person,
Oh,
and
thank
I think
you.
you're doing great work, truly. And my audience was excited to have you.
Cool.
We were discussing yesterday. This is such a hot topic, and you've got such an amazing reputation. In the beginning, when we started, there was Dr. Leah Murray is just amazing. She's such a powerful healer. So really acknowledging you, and thank you so much for your time.
Thank you.
And we will definitely discuss maybe doing a workshop. We both in Cape Town, and maybe something nice in winter that we could organize and get some women together, men.
Yes, no, absolutely. We are doing another, Shiv Dawson and I are doing another retreat on the 26th of May. So that also, and it'll be the whole 25-day gut reset as well. So same as you did, yeah.
And have you advertised it?
Not very much, but I must, yes.
Well, for everyone that is watching and listening and going to listen, just follow Dr. Leah Murray, and you will see. I already saw the flyer, and I took a screenshot. And the venue was just like, are you having it at the same venue?
Yeah,
it was amazing.
Exactly.
Delicious lunch, delicious. Everything was just amazing. So okay, that would be amazing on the 26th of May.
Yeah, and we'll go through all those basics as well again. So
very grateful. Thank
you
you, and
so
I hope
much
you
for
have a
having
lovely
me.
weekend.
Yeah, you too.
Lovely to connect with you. Thanks so much.
Okay, thank you.
Bye.
Cheers, guys. Bye.